they can listen to the call. So welcome once again to the our Gfan call. On this call, we are going to be introducing our new Speakers Bureau, and it is such so excited to be doing this. So we've been working on this for many months, and I'm so excited to introduce you to all of our new speakers. So we will be introducing you to them, and also showing where you can find new information, and we'll have a little bit of discussion on what types of activities that speakers do. Following that, we're going to be also sharing our World TB Day materials, so details on Gfan's World TB Day plans, and an opportunity for others if they have some World TB Day plans that they'd like to share with us. So I'm just going to get started right away, so because we have a busy schedule and I don't want to delay too long. So without further ado, welcome our new 2021-2022 Gfan Speakers Bureau. I'm so pleased that everyone is here, and not all of the speakers could make the call today, of course, but we've tried our best to get as many as we could. So I am going to start with, I don't think it would be all that interesting if I was the one introducing everyone. So I'm going to have them introduce themselves, because listening to me talk is less interesting. Sorry, my headphone just fell out of my ear, which is not helpful. Can you still hear me okay?
Yep, you're good.
Okay, good. Thank you. So without further ado, we have two returning speakers, Anton and Miriam. So we're very pleased that they are back once again, and we will be hearing from them later on in the call, where I don't know if Miriam has made the call, but I believe I saw Anton's name on our list. We'll kind of talk a little bit about what are some of the activities that speakers have done in the past. So we're very pleased that both Anton and Miriam have returned. I also want to introduce the new speakers from the Africa region. And instead of me introducing each and every one of them, I'm just going to ask that they either raise their hand or just unmute themselves and just say a few words about who they are, and a little bit about themselves, why they wanted to become a Gfan speaker. So if folks can go ahead. I may just start picking on people, and because Aaron has the first name in the alphabet, he's the one that I see on the top of my screen. Aaron, are you able to step away from your meeting and say a few words?
Yeah. So this is actually afternoon here in Nigeria. So good afternoon, everybody. My name is Aaron Sunday. I work with African Network of Adolescents and Young Persons Development, INITE, as the Executive Director. I'm based here in Nigeria. I'm also a young person living with HIV for almost 16 to 17 years. Global Fund have really impacted in my life, both as an individual from health-wise. I've been assessing my ARVs and also assessing cares in Global Fund supported facilities since my early adolescent age until today. And also as a professional career, I'm also on the board of Global Fund as the youth member of the Developing Countries NGO delegation. And from organization-wise, Global Fund have also supported my organization with a technical assistant grant to ensure meaningful engagement of adolescents and young people in the diversity in the recent window RFP funding request that Nigeria sent. And I'm pleased to announce to everyone, for the very first time, we've been able to achieve a feat whereby young people have their budget, and we are going to be fully implementing project for them in Nigeria. Thank you very much. I'm also a TB survivor. Thank you very much.
Thank you very much, Aaron. I am going to go now to Miranda. Miranda, are you able to unmute yourself?
Hi, everyone. I'm Miranda from Cameroon. I'm the Her Voice Fund ambassador for Cameroon, and I'm also a member of the CRG advisory group at the Global Fund. I applied to be a member of the GFA Global Fund Advocates Network because I like speaking. Speaking is and has always been a part of my advocacy. And from my experience, speaking has pushed a lot of people and motivated them to take action. And the Global Fund has empowered me as well through the Have Voice Fund to engage and inspire communities and lead community-based responses to HIV, TB, and malaria. Thank you so much for the opportunity and looking forward to more engagement with the other people.
Thank you so much, Miranda. I'm next going to go to Naomi. Are you able to unmute yourself and say a few words?
Hello.
Hello, we can hear you.
Okay, my name is Naomi Wanjiro. I'm from Kenya. I'm a health professional. I'm a nurse by profession, and I'm glad to be here. And TB is really a disease that can be cured, but people take it for granted. Let me say I got TB and I really suffered as a health worker. And I would like to say that I want to be a Global Fund speaker so that we can join together. The community can know about TB, but when they come to the hospital, the health workers don't have that time to screen the clients. It is our responsibility as health workers to screen those clients that have come from the community. It is my request that we join hands together with the other speakers from the Global Fund so that we can tell people that treatment is for free. I got my treatment free without even a cent, without even missing one day, and they were there on time. So I would want to say that Global Fund has really supported me individually and are still working in TB clinic. I've seen people coming to the clinic while they are very sick, but they have improved because of this medication. So I am glad to be part of the Global Fund speakers, and I'm happy. Thank you.
Thank you very much. Crystal, are you able to unmute yourself, please?
Yes. Hi, everyone. My name is Birunje Crystal Mwesiga, and I am from Uganda. I'm an entomologist, and I work at the Uganda Virus Research Institute on a project called Target Malaria. So our goal as Target Malaria is to develop an innovative, sustainable, and affordable malaria vector control tool using gene drive technology. I will not say a lot about it, but please feel free to look it up. If you Google it, a website will come up. So I'm an advocate for the Global Fund because here in Uganda, it funds many of our public health programs, including those that are working with HIV, TB, and of course, malaria. So I have intimate experience with the malaria disease. Aside from nearly dying from it myself, I've actually almost lost 2 siblings to it. And it is generally not a rare disease, what I would say here in Uganda. It is a distressingly common story here. So Global Fund programs, since they started working in Uganda, they fund something we call the village health teams that bring healthcare closer to people. They educate the populace and give first aid. Global Fund also funds the distribution of mosquito nets across the country and also drugs at healthcare centers. So since these programs went into effect, we've had childhood deaths for children under the age of 5 fall from about 10% of all children under the age of 5 dying in every 1,000 births. So basically, with for all children born, about 10% of them would die before they turn the age of 5. And that is truly distressing. So when you think about the fact that these are the numbers and people don't know these numbers, I'm sure that many of you here from Africa probably have some experience with malaria. And yet for this curable disease, we still have people having no idea what kind of impact it really has and what kind of difference the Global Fund is making, because we've had those numbers fall from about 10% to a little bit less than 5%. So we have a long way to go. You cannot have a disease that is killing 5% of all children before they turn the age of 5 and allow this to go on. And for that, the truth is just we need money. So the Global Fund funds this, and the work they do is amazing. And I am happy to advocate for it. And I am hoping that we'll be able to make people understand the importance what they do and why it's important to contribute to the Global Fund. Yeah, together, I believe we can really make a difference. That's all.
Thank you so much. Joyce?
Thank you, Tara. Hi, everyone. My name is Joyce Uma. I come from Kenya, and I'm currently representing adolescents and young people at the Kenyan CCM, and I also am a youth member of the Communities Delegation to the Board of the Global Fund, and an observer and member at the Global Fund Youth Council. My profession, currently, I am working with the National Empowerment Network for People living with HIV and AIDS in Kenya as a program officer, advocacy and research at the AVAC 2020 Fellowship. And I wanted to join the Gfan Speakers Bureau because I am good at speaking. I think I have some good public speaking skills, and most importantly, I wanted to help raise resources for the Global Fund. And just like every other speaker who was spoken before me, the Global Fund is doing amazing work at the at the country level and at global level, and I'd just like to be part of the resource mobilization for the GF.
Thank you so much, Joyce, and thank you all of you for that. Now I'm going to move on to our next set of speakers. So we have a number of speakers from the Asia Pacific region and Eastern European. And I am going to check. Ani, I think I saw your name pop up. I know I did. So I'm going to pick on you first. Ani, can you please unmute yourself and say a few words?
Yeah, thank you, Tara. And hello, everyone. And I'm happy to be part of the Global Fund speaker. My name is Ani Hernasari. I am a MDR TB survivor and currently serving as a vice chair of a national organization of TB patient and survivor network called PopTB Indonesia. PopTB Indonesia is like an umbrella organization for the 19 TB affected community organization in 14 provinces in Indonesia. I am also a member of the Global TB Women Steering Committee held by Stop TB Partnership. My motivation for becoming a Global Fund speaker is to gain like additional experience and knowledge about advocacy, human rights, and how to become a good speaker, and to maintain and increase about how to support for the investment in the global fund domestically and around the world. And the financial challenge posed by COVID make this sort of advocacy is more important than ever, I think. And I want to make my contribution to my country and give it back to the TB response on behalf of the TB survivor and people with TB who are still undergoing with treatment and still struggling to complete their treatment. Over to you, Tara.
Thank you so much, Ani. Handa, I think I saw your name pop up on the.
Yeah, can you hear me?
Yes, I can.
Hi, everyone. Thank you all so much for having me. My name is Handa. I currently work in the humanitarian sector, focusing on refugee empowerment programs. I'm usually based out of New York. Currently, I'm back home in Mongolia, where I'm from. I recently authored a book titled Stigmatized that shares my story of overcoming tuberculosis, and that's how I got more involved with TB advocacy and activism. In the near future, I plan to start TB People Mongolia as one of the first, actually the first survivor network in Mongolia to provide safe space for TB survivors and current patients. I'm excited to be part of this Gfan network because I want to destigmatize and humanize TB, because as you all know, that the stigma that's attached to TB makes it hard for people to fight this disease in a dignified way. And I really want to change that. That's why I joined this network. Thank you.
Thank you, Handa. Gautam? Are you able to unmute yourself?
Hi, good evening. Can you hear me?
Yes, I can hear you. Please go ahead.
Yeah, so my name is Gautam Yadav and I'm from India. And currently I'm working with the Humsafar Trust, which is India's first LGBT organization. I'm working as a research assistant with the organization. And I'm also part of one organization called MPECT, which is based in California. I'm the steering committee member of the MPECT. Why I'm here in this Gfan group, because I feel that till now I have done lots of advocacy work related to people living with HIV and for the LGBT community, and I myself identify as gay person and living with HIV since 2009. So regionally, globally, and in country level, I have worked a lot for the people living with HIV and for the people from the LGBT community. And I was also part of the Supreme Court case, which was 377 case for decriminalizing homosexuality. So I was also one of the petitioner in my country. So I feel that with my work experience, I will be able to make some changes and have some networking and do good work with other GFAN speakers. Thank you.
Thank you so much. And finally, last but absolutely not least, Olia.
Hi, Tara, do you hear me?
Yes, I can hear you.
Okay, hi everyone, glad to meet you all. So I'm Olia Clemenco, I'm from Ukraine, and in 2016, after tuberculosis, I became a volunteer activist, and I joined into the global community network TB People, and after united with partners and community members, we founded TB People Ukraine in our country. In 2018, with the support of the Global Fund, we were able to develop the direction of mobilizing the community in Ukraine, and from this time we worked with a few areas: advocacy to meet country commitments, change the system, not only medical system but also in social system, implement of TB transition plan, monitoring community basic monitoring, and provide the direct patient care to keep people on treatment. In Ukraine and another country in ICA regional, we have enough donor support, donors financing support, but I can tell that we have some great results or positive changes in our common TB and HIV epidemic. Nevertheless, for the donors, government's position is more of priority, and the community doesn't have enough influence on the process. Being speaker, Global Fund speaker, is also opportunity to strengthen the voice of the community, and at the same time to be stronger representatives for the government agency. Perhaps this will help maybe in the fact the Global Fund will be able to more influence in the creation of political will. So I think together we can save more lives, and I hope to defeat the discrimination in the world associated with tuberculosis. With another epidemic too, but my expertise is it's tuberculosis. Thank you.
Thank you so much, and thank you to all of our speakers for taking time out of their days to come and share their stories with us and introduce themselves. I very much appreciate it. I'm just going to, you can learn more about the Speakers Bureau and our speakers by going to our website, and the link is up, and I'm just going to put it into the chat as well for everyone. Just give me 1 second. There we go. So if you want to have a look and learn more details about the stories, but that our speakers have to share, you can go click on that link and it's in the chat, and I'll also share the link over Gfan when the call recording goes out. Right now, I just want to, because some of you may not know what the work the speakers have done in the past are, and we have a number of our former speakers and returning speakers that will be that are on the call, that are going to just take a couple of minutes and share what kind of activities and roles speakers have done in the past. I'm going to start with Maureen. Maureen, could I ask you to say a few words? Maureen, I'm afraid we cannot hear you.
Can you hear me?
Yes, I can hear you now.
Okay, yeah, so my name is Maureen Murenga. I am a former Speakers Bureau member, and I think I've been there for a while. I started off as when the title of this position was not a speaker, but we were called the Here I Am campaign ambassadors. And what we did as Here I Am campaign ambassadors, just as the name said, we were doing advocacy for resource mobilization of the Global Fund through talking to donors about what the Global Fund has done, and mainly putting a face into the graphs and the figures they have always received. So we went to capitals, we went to meet members of parliament, and we had conversation on how Global Fund has impacted on our lives. And I think putting a face gave quite a difference, because they could now relate to some of the decisions they make around funding the Global Fund. So we did that so much as Here I Am campaign. And slowly it was just about one person who has benefited from the Global Fund through, like, for example, myself through HIV treatment, through malaria treatment, and also my son had TB and I lost several very close relatives to TB. So it was just putting the figures they get, putting a face to it, and they would ask a lot of questions. So through the questions we were asked, we realized that we needed to at least understand the fund, understand some of the statistics, and be able to answer the questions that we get. So we also realized that we needed a lot of confidence, because you sometimes find people who are very anti-funding Global Fund. So they really intimidate. So through that, we had trainings on public speaking, and we also kept abreast with the Global Fund, ensuring that we are true ambassadors of the Global Fund, defending the Global Fund when there is bad publicity. Sometimes some of the members of parliament would wait until you are talking to them before they remove an article that was written by Gata Press or something. So just ensuring that you continue remaining an ambassador to the fund. We also learned how to not answer what we were not sure about. And so that has been our experience. I think I've been to the UK, I have been to Germany, France, I've been to US several times, and yeah, those are most of the areas where I have been as a speaker. And the experience is very refreshing when you are able to convince someone to continue doing what they're doing, because you're benefiting from it, and not only you, but your community. It is also very refreshing for them to put a face to some of the decisions they make, and to some of the decisions they need to make in future. So that was just, in a nutshell, not to take so much of the time, the main reason why I was happy to engage in the Speakers Bureau is that I'm a beneficiary of the Global Fund, and I saw the results, and I saw the interest that donors of the Global Fund had when they listened to our stories. Thank you.
Thank you, Maureen. I'm going to call on Timur. Do you have anything that you want to add? Hi, go ahead.
Of course, I'm a former member of Speakers Bureau. Of course, I have something to add. So guys, if you really love speaking, yeah, that's definitely the right place for you. Though Maureen was very right, saying that It's also a very important skill in Speakers Bureau to sometimes know when to shut up and to say like, you know, let me rather say something else. So that's really an important thing, especially when you have journalists in the room. Anyway, I'm Timur. I'm a person living with HIV, a TB survivor, and yeah, I'm a passionate speaker in general, I would say. I served one term as a speaker, and then I thought that probably I should let others join and have the opportunity. Because like one thing that this will give to you, and I really hope that there will be actually two. One is you will become such a professional teller of your own story that, you know, you will just tell it so calm, you know, unemotionally, because you will just get used to that, to telling your story. Because even though we as communities, we are struggling not to be seen just, you know, talking faces, but actually when we go and meet the donors, we do need to let them know that, yeah, this is the face of people who are being saved by the Global Fund, because not necessarily they have ever met anyone saved by the Global Fund. So yeah, this is one skill you will learn. And then another thing about the Speakers Bureau is that, as Maureen said, you get to travel places. I really hope that with this COVID thing coming to end soon, hopefully, and you can get it as my professional forecast, very soon we will be able to travel again as countries adopt this vaccination passport kind of policy, when just like you have to have this yellow fever vaccination certificate when you travel to some countries in Africa, same thing will probably be with COVID. And once you're vaccinated, you will be fine to enter a country. That will happen very soon. So now it's the beginning of your term. You will travel places, folks. I can guarantee. You will be talking to different people, not all of them pleasant, but that's also the beauty. You will be learning how to talk to people who you don't really like. You know, sometimes that's the reality. Yeah, so I'm a former speaker now. It's supposed to be a mentor. And I think it's a great opportunity to actually help you guys. You're already great speakers, but for myself personally, it's just a great opportunity to let you know how to be more effective. We always need to learn, no matter how good we are. And I believe that with such a great bunch of people in the Bureau right now, we will be able to make the Global Fund well replenished, the responses well funded, at least at the global level, and we will probably make some change for some real people out there in the countries. Thank you, over.
Thank you so much, Timur. I really appreciate it. And finally, I just want to leave the last word to Anton. Anton, if you could share a little bit about what kinds of speakers trips you have done, that would be lovely.
Whoa, it's so difficult to compete with Timur and Maureen. Yeah. First of all, I would like to share some of my impressions for this call, and I feel like it's like a second time you step in the same hole where the bomb is already boomed, but in the good sense. And yeah, I feel like. First of all, besides all that roles and objectives of our roles about which Timur and Maureen already spoke, I think it's really symbolic that today in the World Discrimination Day, one of the serious roles for every speaker will be to reduce global stigma and discrimination to key populations and communities you are representing. Of course, we are doing this kind of fundraising or advocacy for attracting funds. Yeah, but actually our agenda or our mandate is much more wider than just reach the donor country representatives and just to speak, hey, please help the Global Fund. So I have the long list of my different affiliations, but my name is Anton Basenko. I'm also from Ukraine. I'm a person living with HIV and already cured viral hepatitis C, and I'm a person who used drugs more than 20 years. And I, as I love to say, I'm one of the already 38 millions of lives saved by the Global Fund. What I've done already as a speaker. So besides the general photo or video portfolio everyone is expected to have soon, with which some of your materials could be used for the posters or some kind of I don't know, snapshots or media, but mostly the role is joining official events, mostly high-level events. In my case, it was, for example, high-level meetings on HIV/AIDS or tuberculosis. So it's a level where the kind of first people from the governments of different countries joining, or the heads of the UN agencies, for example. It's also interaction. So I've been to UK interaction, doing some interaction with member of British Parliament around tuberculosis, interparliamentary group. Also, Peter Wiesner is here, and the last of my travels was to Berlin, and it was really great story about the German government and the decision makers in Germany as one of the big donors for Global Fund, where I shared my story. And it's always really difficult to not only to repeat your story, but really to find some new nuances which can be closer to the particular auditory you have. Of course, you are all asking you a question. Oh, I'm not a good speaker, maybe. Or, believe me, all these skills and knowledge you will have if. Moreover, if it's the same team of trainers as Susan AIDS, for example. So no, don't worry about skills. You will have these skills, but I think I'm absolutely confident all of you have really unique stories which can definitely break the hearts of people, despite on the level of position of this person, whether it's a queen of United Kingdom or in Great Britain, or whether it's a president of US or Prime Minister of Canada. That's what we do, and that's actually what we are gonna do. And I'm really glad to stay with you. That means that I still have what to say, and I'm really pleased and appreciate to be in some sense mentor for the new speakers as well. Thanks.
Thank you so much, Anton, and thank you to everyone. I really appreciate you taking your time out. I'm not sure that any of the speakers have met the Queen of England before, but that let's aim high. I want to leave some time to get to the World TB Day stuff, but we've also kind of been looking for sign of for while travel is still limited, we're hoping to have some ideas for speakers engaging with parliamentarians without having to travel. And I do know we have some, I've heard some good ideas, and I'm wondering if Kaja might put you on the spot if you want to talk about your idea just for a couple of minutes. I would really appreciate it. I'm being a little bit mean to poor Kaja.
Yeah, sure. Let's just do this. Thank you very much, everyone, for your presentation. I mean, it's really great to see such a great group of people we'll be able to work with in the next coming months. So my name is Kasia. I work Kasia Lemańska. I work for AIDS funds in Brussels. So we do advocacy towards the European Union. The European Union is a quite big champion of the Global Fund, but it is a quite difficult period. A lot of funding is going towards COVID. There is a lot of competition when it comes to resources for health. I mean, we're looking at the next replenishment, but also with a bit of concern. If I had to compare to the kind of more, let's say, positive outlook we had in the previous replenishment. And so we're also struggling a bit with the type of events we have online. We see a bit of a fatigue when it comes to parliamentarians with webinars. And so one idea we had in mind was to basically do what some of you spoke to, is actually putting faces behind the numbers. So instead of going forward with this a bit cold advocacy with you know, the Global Fund has saved so many lives, basically what are the story behind that? Who are those people that the Global Fund has really helped? Who are the people who are living with the three diseases? What has been their experience with the Global Fund? And I think it's also valuable for the MEPs, members of the parliament who are supporting, who will be helping us support a new replenishment for the Global Fund, to also understand what the funding they're committing to the Global Fund is used for. So what does it actually mean for people's lives? And so we would like to do, I mean, we haven't found a good name yet. We still have to work on that, but it would be some sort of speed dating event. So asking 4 of you to have a 4 to 5 minute exchange with 4 MEPs, and coming from different perspectives and from different regions of the world, or from different communities or age groups, you know, to have this actually exchange with MEPs and to be able to tell their story, to be able to answer to the questions about the Global Fund, and to basically help us turn them into champions. We could then, where we can actually build on that relationship when it comes to advocacy for future replenishments. So the event we have in mind, we were thinking about doing it around TB, World TB Day, but it's a bit too early. Now we're thinking at the 7th of April, which is World Health Day. Using also, I mean, we're an HIV organization, so for us, the hook of the 40 years of the AIDS response, to get them on board, linking it up with the response to COVID to a certain extent. But yeah, I mean, we will be reaching out to you this week. I mean, to some of you to discuss your availabilities and to see if you could be able to join us in that. To that event. I mean, it's the first of a kind, so there's still a lot of question marks, but I'm sure we can turn it into something that is interesting for you, and that is also valuable for members of the parliament. So looking forward, and thank you very much.
Thank you, Kaja. So there are great ideas out there for what we can do when traveling is still limited. Timur, I see your hand up, and I'm going to go over to you, but then I definitely need to do the World TB Day materials and share those. So Timur, over to you.
Yeah, thanks. Maybe just quick feedback on what Kasia just said. It would be actually good to include TB as well, because the years that AIDS has been killing people, most of those years, TB has been killing people living with HIV. It wasn't really AIDS in a lot of cases when this was happening. So I'm just trying to see whether you could include the focus not just on HIV, but also on TB. That would be really helpful. And I'm sure we have speakers who can speak to both. Thank you. Over.
Thanks, Timur. I believe Kaja had intended to do that. That when her and I had discussed it earlier, we had definitely talked about making sure that the TB voice was heard, and I can see her nodding in her video. So, I'm just going to move this along, just because I don't want to lose our lose the World TB Day materials. So I'm going to go right to that now. We have we're very excited to be launching our World TB Days, and our World TB Day stuff is going to be featuring some of our speakers with TB stories. So you can find the key campaign right at this link, which I am not sure. This is going to pop open another screen, I think. No, it didn't. So I'm just going to pop that into the chat right now, a link to the campaign. And we, of course, will share this afterwards with everyone. And I'm just going to quickly go through this, and then I'm going to open the call up to others if they want to share the work that they've done on or that they're doing on World TB Day, because I'm sure there are lots of other great ideas and that. Like, so the tools, just need to minimize this. Gfan will be launching a new content each week of March leading up to World TB Day, and all participants, we're hoping that everyone can use our materials, and every Monday we'll post a new graphic feature, and what we are asking is that you will be sharing, you'll hold off and share each week the different one, and not bounce them around too much. So I would appreciate if you did that. We have included speaker social media and hashtags in there, so you can share those as well. And we're featuring just a few of the speakers, and we will also be sharing some blog posts, and those will come out throughout the month as well. And they may feature some of the same speakers or some new speakers. So the first one we are going to be sharing will be Meet Ani, and as you can see there, you'll be able to download the graphic here, and there will be a link to her profile and some sample captions or posts that you can use. The second week will be featuring Naomi, and again, a similar with any tags that she has, and a graphic that you can download as well. The week of March 15th will be featuring Olya, similar, I'm not going to repeat myself. And then finally, the final week, we will be featuring Handa. And what we also want to do is in and around World TB Day, we'll be doing one launch of a video that we'll be putting together featuring a number of the speakers with TB stories. And as I mentioned before, we will also be sharing blog posts featuring our speakers as well. So we thought this would be a nice way to feature kind of the work of our speakers, or introduce our new speakers, and hopefully share their TB stories. I have seen in the chat that Jennifer has shared the Stop TB World TB Day stuff. I wanted to invite anyone, if you want to raise your hand and say a few words about your own World TB Day efforts. I think I see a number of people from Stop TB. So if anyone wants to jump on the call and just say a few words about their campaign, the floor is open. I'm not hearing anyone jumping up.
a lot of voices, huh?
A lot of voices.
Actually,
maybe. Sorry, go ahead, Timur.
Yeah, there was just one thing where we're chatting with Peter on the side in the chat, and basically one thing that he was wondering is whether we could also speak about like more resources for TB within the global funds. But that's like, you know, the TB 33% campaign, which is now led by civil society. But that's probably not the best idea for the Speakers Bureau, because we are raising resources for the Global Fund, and we're not really working with the Global Fund in terms of how it's spent. That's my understanding. So probably the call has to be around this World TB Day. As far as I know, Stop TB Partnership made it, the clock is ticking to 2022, when the world is supposed to deliver on the political declaration. So this should probably be like the bottom line, and the Global Fund is playing a huge role in terms of making countries, like making it possible for countries to deliver on their commitments around the political declaration. But then another thing is it should be around the impact of COVID on TB programs. And it's the same for the other diseases, but we're speaking TB now, so that's why I'm saying this. TB responses were hit the heaviest by the COVID pandemic. That's what data is suggesting. So we definitely need to do something around those lines. We just, some countries lost up to 8 to 10 years of progress made in terms of responding to TB. So that's when you think about how much money the Global Fund invested to achieve that progress, and losing it just over 1 year is a nightmare. So probably we should be calling countries to remind them that, well, you may care about COVID, but we're not surviving COVID to die of freaking TB. So that should be really the call. We're not surviving COVID to die of HIV either. And same with malaria. So just focusing on COVID is not helpful. This is what we should be reminding the world, and particularly the part of the world which is giving the money. Thank you. Over.
Thank you, Timur. Peter, I see you have your hand
thank
raised.
You. Yeah, can you hear me?
Yes, I can hear you. Please go ahead.
Yeah, I just want to reiterate on what, of course, Timur has already mentioned, that we immediately after the UNL meeting, then we had COVID that derailed the whole our old dreams about eliminating TB by the year 2030, and we walked a few back, and that's why in our campaign now during the World TB Day, there should be an enhanced voice on TB. Of course, malaria and HIV have also been affected as much, but TB again is we have more cases because of the diagnostics and also as a lung disease. So that's why I felt that probably our 33% should also be voiced out, not to get funds from any other two diseases, but just to have other partners come in the way they have come in for COVID-19. Thank you. Over.
Thank you very much, Peter. Sorry, I was looking for my unmute button. Did anyone else have anything that they wanted to share? I expected people to have their World TV Day plans to share, but that is fine. Anyone else? I'll just give a moment. I don't think so, but
sorry. If there's nobody else jumping in, we have already, we are working with at the National TB program. We are having our World TB Day on 24th, and we have selected the town of Meru. We'll be sharing it in the tweets and in Facebook and Eddie Forum. We are really organizing a big World TB Day in one of the counties where the TB burden has really increased in relation to other counties in Kenya. Thank you.
Thank you so much. I appreciate that. And so I think I'm going to wrap up the call here unless I see anyone else raising their hand. I just want to remind everyone on the call that you're very much invited to next week's launch of Gfan's strategy. We are hoping it'll be a little bit more of a relaxed event. So we're encouraging people to bring their favorite beverage and join the launch. And you'll hear from some friends of Gfan, and where we'll share kind of the strategy, what Gfan strategy going forward from 2021 to 2025. So we'll have Francoise Vanny from the Global Fund saying a few words. We'll have Lois Maturu, a former Gfan speaker, and we will be having the head of our steering committee, Joanne Carter, from Results US speaking. Katie, did I miss anyone? I don't think so.
Yeah, I think we do have another speaker, but we're going to embarrass ourselves if we forget right now. And I'm also forgetting, but we'll continue to send out reminders, and we do have some great friends who are joining us to share their experiences with Gfan and to share with you the new strategy. So we're looking forward to that. So please do join us next week.
Apologies to the mystery speaker on the call. But anyway, so I want to, it looks like we're going to wrap up a few minutes early. So I would just like to say thank you to everyone for joining the call. And I hope that Rosemary, of course, Rosemary from Gfan Africa. Sorry about that, Rosemary. It's just one of those days. So please go ahead and have a look at the links that we shared with all of the information about the new speakers and for our World TB Day Toolkit. If you have any questions or concerns, please don't hesitate to reach out. And thank you again all for coming on the call, and have a wonderful rest of your day. Bye.
Bye.
Thanks, everyone.
Bye.
Welcome all
Thank
the
you very
speakers.
much.
Bye. Thank you.
Bye.
Bye, thank you.
Auf Wiedersehen. Tschüss.
Bye-bye, guys.
Bye. Wiedersehen. Ciao. Adios.
Bye.
До свидания. До
До свидания.
свидания.